अब सपना छैन टाढा नजिक आउँदैछ भविष्य खोज्ने मनले ग्रेट आइभी पाउँदैछ साथ विश्वासिलो यात्रा आरामदायक यही हो हाम्रो रोजाइ यही छ साह्रै लायक ग्रेट आइभी
Hyundai Creta Electric, undisputed, ultimate, now electric.
हामी चाहिँ हैन कसरी चाहिँ डिप्राइभ्ड भयौं कि रोबोटिक्सबाट है हाउ डिड वी नट गेट रोबोटिक्स इन नेपाल when robotic operations were done 25 years ago in the Western world, you know, or even in India like 15 years ago. How did we get deprived from it? But finally, it's here. I know. What had happened? Like just a backtrack of it.
Yes, like you say, the robotic system has been around for more than 20 years since the introduction of the Da Vinci system by Intuitive in California in the US. In year 2000, obviously there was a lot of work behind it for many years before it could be applied in the general public through kind of FDA approval, which was in year 2000. Obviously it took off in a big way in the US. The US government, the US funding and the health system is on a kind of different scale altogether. अनि त्यहाँ चाहिँ अब urology, gynecology, GI surgery सबैमा चाहिँ त्यसको चाहिँ एकदम राम्रो success भयो and they had the funding for it. Rest of the world were a little bit skeptical. Obviously in the UK also it was around 2007, in India 2000, even in India, in the All India Institute of Medical Sciences, I think they quickly cottoned on to this and wanted it.
The Da Vinci system, right?
System.
Show everybody the Da Vinci system that we're talking about, right? So this is one of the first robotic systems used in the world?
Yes. So this one is the single port system, which is one of the latest ones. Here, everything comes through one port instead of 3 or 4 different ports. All the instruments, including the camera, which you can see is like a cobra's head.
Yeah.
It moves in tight spaces. You've got your arms where you use different instruments like scissors.
So that is pause it, boys. So that's the camera on the top.
Yes. So that's the camera. This is one of the latest single port systems made by Da Vinci. So so you could have your very big operation done through 126 millimeter one port. Okay, like your prostate cancer operation or your kidney cancer operation where you just remove part of the kidney or you do some fine kind of kidney pipe pyeloplasty type reconstruction operation. This could be done with one incision. So this is the future, and this is where we are headed in terms of big complex operations, particularly inside the abdomen.
Yeah.
Whether it's GI surgery, removing bit of the bowel, gallbladder, that kind of thing, or gynecology.
Or what
urology.
my dad got, the hernia operation.
Hernia operation, yes. So that could all be done through one port. That is where the future is in surgery, and the future is already here because this single port has already been around for around 6-7 years in the US.
Yeah.
Obviously, the ones that we use worldwide is the multi-port system. That's the most common one available throughout the world. So to go back to your question, why has it taken so long? In every health system, there are a number of reasons, and one of the main reasons has been financial. Obviously, the US financial system is very well supported.
Yeah, it's robust.
It's very robust, and they support new applications, which may be expensive, but actually, one of the reasons why this has been successful is because it is very precise, it is very accurate in terms of the fine movements that you need inside the body to remove, for example, tumors with clear margins, or to protect tissues, to align, reconstruct, suture, anastomose, joints in a very fine and precise way. And and this translates to good outcomes with very low complications. And this has been proven over the last 20, 25 years for a lot of different operations done robotically. So that is why in different systems, what you don't want is your patients kind of coming back with complications, readmitting, reoperations and all this. And the patient's not happy. It's not good for the patient. And it also adds to the costs in the bigger picture for the insurance payer, or if it's out of pocket through आफ्नो पैसा खर्च भए पनि. So for multiple different reasons, this is a success story worldwide. So यहाँ चाहिँ अब for example in the UK also there was skepticism
in the beginning
to say, is this a gimmick? Because the UK health system, for example, which is where I spent a lot of time initially, there was skepticism, big question marks. Is this going to cost the government a lot of money? How are we going to fund this? तर चाहिँ अब त्यो सबै कम्प्लिकेसनहरू, लेन्थ अफ स्टे इन हस्पिटल, ट्रान्सफ्युजनहरू, इन्फेक्सन रिस्कहरू, पेन, द रिकभरी, एभ्रिथिङ इज सो मच बेटर द्याट इन द बिगर पिक्चर इट्स वर्थ द इन्भेस्टमेन्ट होइन. अनि त्यो भएको हुनाले चाहिँ अहिले फास्ट फोरवर्ड अब 10-15 years युकेमा पनि 100+ वटा सिस्टम छ त्यत्रो सानो कन्ट्रीमा. डाभिन्ची
Google Google on the AI mode. When was Da Vinci system created and who created it in the US? Let's Google that and let's find that out. I'm sure you already know that.
Absolutely. In the 90s, they did a lot of work, and they had a lot of collaborations between a lot of companies to bring about intuitive. They went through their clinical process and. The system that they launched was FDA approved in year 2000, I believe.
1995, Dr. Frederick Moll and John Gordon.
Yes, in the 90s.
Freuden and Robert G. Young, they created this system.
Yeah.
Da Vinci surgical system. Right, that's the system that you were trained on. You were trained on.
Yes,
one of the systems that you were trained on. Dr. Pratik, let's get started with a little bit of your history. I know, of course, Hazur, you studied in Xavier's, if I'm not mistaken.
That's right. Yes.
And then you headed to the UK because I believe Chief Saab at that time was somewhere in the UK as well, and then the family moved.
Yes.
Along that line.
Oh. त्यही भएको त्यही हो. त्यहाँ म यहाँ एसएलसी दिएको थिएँ. So I was just waiting for my exam results, and my father had been appointed as military attaché in the UK for a period of 3 years. So I was very lucky in terms of my timing to kind of make the extra step in terms of higher studies, and thankfully I managed to get a scholarship. Full academic scholarship in Ardingly College, which is one of the big colleges in the UK, and that's where I took up some subjects in the area of interest, which was sciences, A-level sciences, and based on that, I was able to apply to
UCL
medical school.
Fantastic! You went to the University College of London, if I'm not mistaken.
Yes, University College London, University of London. Yes.
And how did that shape you as a human being there and studying there? Honestly, I'm asking you this.
Yeah, I mean, I felt a sense of achievement because I couldn't have imagined getting into a kind of top-class university
in the world.
In the world, it's one of the kind of top-ranking ones. So I was very lucky to get a place, particularly to study medicine there. And I studied hard, but I was also into sports. So I played a lot of football. I represented the medical school and the university all throughout the kind of 6 years I was at med school. I also got the opportunity to intercalate an extra degree. So if your basic sciences are good enough, and if you're interested, you have the option to study for an extra year to get an extra degree. So that was in surgical oncology in the Department of Surgery, which is what I was interested in, and that also kind of helped me in terms of also furthering my academic interest with a PhD in uro-oncology in due course after I qualified. So, yeah.
And at one point, I was reading up. Obviously, I was reading up on you as well, and then there was what was the thing that triggered you and that caught your attention? That all right, I need to go ahead and jump into robotics. What was that trigger factor? Okay?
Yeah, I mean, as you saw from the clip, people are already talking about robotics in surgery. I was interested in surgery, so I qualified in year 2002.
Exactly.
So
this is
in
back
the 90s,
in the day. Yeah.
in the 90s, and they were already talking about in the US they're kind of doing the robotics operations, and I the first time I kind of saw all this firsthand was around 2006.
2006.
Yeah, I was in the US. I went on a urology kind of annual American Urological Association conference. त्यहाँ गएँ. त्यहाँ the robotics was a big thing, so I got to see live operations being kind of streamed to the audience. You could see how the visuals were fantastic. All the fine movements were perfect, and you could also see the systems being displayed by Intuitive. It was a big thing in the US, and it was about to be a big thing in the UK and the rest of the world. So that really caught my attention, and I knew at that point that look, I'm doing a lot of open operations.
Yeah.
I'm learning a lot of open operations, and I'm beginning to learn a lot of laparoscopic operations. But that's what I need to be doing.
You jumped into the future. This is the future. तपाईले हाम्रो क्लिप एकदमै एन्जोय गर्नुभयो होला. अब पुरै भिडियो हेर्नको लागि चाहिँ युट्युबमा सब्स्क्राइब गर्न नबिर्सिनु होला.